It's Christmas Eve. Christmas Eve in Tokyo. It's going to be a very tough video. So this week I've seen my immunotherapist on Monday as usual for hypothermia treatment, which is always nice. And then I met two surgeons to talk about the possibility of doing this very extreme surgery and treatment called cytoreduction on HIPEC. Cytoreduction means they open up your abdomen and remove all the cancer that they can see, which means cancer is bigger than 2.5 millimeters. That's what I can see at the moment. Although, just as an aside, it's frustrating, but there are technologies available now that let surgeons see 1 millimeter cancer, and for some reason it's not widespread. So the things like near-infrared imaging, there are like dyes where you inject dye into the patient before you do the surgery. So anyway, and then they in this cytoreductive surgery, they basically scrape away the membrane that covers the abdomen. They also remove all the protective fat on the organs, whether they can see cancer there or not, just because that's a place where cancer often is. If it is possible for me to have it, it would also the procedure would also include very major liver surgery, very, very major liver surgery. And then during the surgery, they put some pipes into you and they basically wash the abdomen with heated chemotherapy agents, usually oxaliplatin, which is a platinum-based toxin. And because they're putting it very directly into what's called the peritoneal cavity, very little of it is absorbed by the rest of the body, which means they can put much higher concentrations in there. The reason they need to put much higher concentrations in there is that usually a very small percentage of the chemotherapy, like that I'm having at the moment, gets into the peritoneal cavity because it's peritoneal cavity is not full of blood. Like the peritoneum is like there's like a barrier, and chemotherapy happens through your blood. At least I think that's my probably incorrect understanding of it. So I talked to the two surgeons about that, and they say it's maybe possible that I can have this treatment. The next step to find out is to have... So yeah, first of all, it depends on whether my liver can be resected, which means can they cut away the part of the liver with the cancer in. So I need an MRI scan of the liver. I've been having lots of CT scans, but MRI scan is much higher resolution. So they'll look to see if it's possible to resect. So one kind of realization I've had is that there's a lot more cancer in my body than I thought, which is just incredible. But with the liver, so in July, when I had a PET scan, which is a radioactive scan of the body, there were 6 visible tumours. So I thought there are 6 tumours in my liver. And then I've been having chemotherapy recently. It seems to be going okay. the CT scans show 4 tumours, but of course the other 2 are still there. They're just now too small to show on the scan, because the CT scanners can only see things about 1 centimetre or bigger. PET scan probably 8mm or bigger. And of course, when the PET scan showed 6 tumours in the liver, there's still lots more there that are smaller than 8mm. So, like when you hear, we always talk about cancer coming back. People say, oh, this person had treatment for cancer and it went well, and a few months later it came back and they died a few weeks later. It's a very typical sad cancer story. But you know what I realised, it's blindingly obvious, but of course the cancer doesn't come back. It's not like the person gets cancer again. It's just the cancer was there, and it was the cancerous cells were remained after the treatment, because we can have clusters of just a few cells, cancerous cells, or tumours that are too small. So a surgeon can see tumours of 2.5mm at the smallest if they're in keyhole surgery. So then, a couple of days later, I think maybe yesterday, I don't know, I spoke to one of my oncologists, so that's a cancer doctor, and in the past I've been investigating all these possible treatments that might apply to me, and so my wife has been searching for this stuff as well. And it's kind of annoying, but when you read about the treatments, when you read the explanation that's for patients, it's really not detailed enough. If I had found explanations for doctors, it may have been more obvious that these treatments would not apply to me, because basically, talking to the oncologist, each possible treatment I mentioned was just kind of ruled out over the course of a 30-minute discussion. So all the possible treatments are basically ruled out because of size of tumours and number of tumours, locations of tumours. That's very upsetting. But kind of even worse than that is that so there's this concept of prognosis, which is like how long you're gonna, prognosis really just means how long how you're gonna do from the disease. Is it how long is it going to take to cure, or how long are you going to live if it's a very serious thing like cancer? And prognoses are given as averages, like what percentage of people were survived a year, or maybe 3 years, or maybe 5 years. With this cancer spread to the peritoneum, they don't even bother giving like 3 or 5 year prognoses, because it's 0, really. But everyone has heard of people who kind of so-called defy the odds, so people who were told, the story is they were told they had a month to live, and 3 years later their CT scans were still showing no cancer, because the treatment had worked so well or whatever. But I now understand that those stories are not helpful, because they're misleading. Because what I found from talking to the oncologist is that when you look at those averages, you can actually pick out, well, I mean, and again, it's blinding numbers. You can, pick out groups of people who are likely to defy the average. And there are various factors that put me in a group of people that are maybe going to do worse than average. Basically because of the number of visible tumours in the liver, really. So it's basically been kind of a week of bad news. And just everything that non-medical people think and say about cancer is wrong. It really is wrong. People have said to me things like, "Oh, you have age on your side." Well, that makes a difference to things like surgical recovery time. If the average stay in hospital is 8 days for the surgery, you might leave. If you're young, you leave after 6 days or whatever. Seems to have quite. Also, first of all, that kind of thing is relevant only if it's possible for you to have surgery. It's horrible to say this, but there's a. It's a 4-year-old kid at the moment facing 4-year-old British kid facing. He's got a couple of months to live. Definitely doesn't have age on his side. It's in the news at the moment. He's been getting all these Christmas cards and raised £700,000 for I think to have immunotherapy in America, and they basically said it's not going to work. His cancer's growing. He's going to last hopefully a few more months, but because he's 4 years old doesn't give him any great survival chance. And another thing that's really, really hard to accept is that good response to treatment does not necessarily correlate to overall survival time. And it just seems unbelievable. There might be a slight correlation. It depends a lot on the cancer, on the origin, of the cancer, on the nature of the cancer. So, two people could have the same cancer, but the nature of the cells is different. I think this is called the histology of the cancer. So they do these tests to see how well the cells are differentiated, and if the cells are very poorly differentiated, so kind of this clump of very similar cells, then the cancer tends to be more aggressive. So those are the real factors that dictate survival time, not necessarily what's called, I think it's called disease-free progression. So every time I get these good results, it doesn't necessarily mean anything. Tough to accept. I'll do some more videos soon, but thanks for listening. And methadons.org is the website if you can help me out with some money for immunotherapy that might work. Thank you.